Good evening. My name is Saraswati Vedam. I'm at the University of British Columbia, and I'm here to tell you about the QMNC Research Alliance Priority number 3. I'm going to share my screen now with you. So the Quality Maternal Newborn Research Alliance you've just been listening to has 3 main priorities. And the third priority is the one that brings the other 2 to the forefront. So what we need to do if we're going to advance all these new areas of research is that we have to figure out what kinds of indicators, measures, and benchmarks we can use that are most valuable. We know that there are several areas that are not yet being measured, that we don't have good measures for novel concepts like continuity or respect, community knowledge, cultural safety. How do you measure health promotion or even integration of services? What are the best ways to measure, understand this? Are they quantitative? Are they qualitative? What components of the framework have not yet have validated indicators? Are any of them co-developed with service users and the people who are most the recipients of care? How generalizable are these indicators? And what populations have we looked at? Have been only looking at the dominant populations. What about immigrants, refugees, people who are marginalized? And and in thinking about the best measures, we also need to understand the types of data, the depth, and use mixed methods or quantitative and qualitative data. So we want to find out both types of things. And of course, there are other ways of measurement to the storytelling. There are things that are more congruent with certain communities. And so we need to work with the communities to figure out how to measure these complex concepts. Our objectives in priority 3 are 3 of them. We want to map the existing measures that are and indicators and tools are out there that are aligned with the QMNC framework. We want to develop a minimum set of core variables that everybody uses and that we use in the same ways to understand and characterize what is quality care. And then we want to align those indicators and measures align with health equity principles and with the framework. And by that, I mean that we want to re-examine the kinds of questions, who owns the data and how owns the way the stories are told or the descriptions are made, what kind of language do we use? Are we using inclusive language? Can we make sure that we attribute authorship and novel ways of measuring things to the people who identify them. And in particular, I'm talking about Indigenous. And there's a research, new principles come out by the Black Mamas Matter. There are Asian ways of knowing. There are many different ways of understanding what reality is and what truth is. So who chooses the questions asked? Whose perspective is measured? Can we value the lived experience of care, since that's what we're talking about? And can we use diverse modes of data translation? Maybe it's the best way to tell a story is through a map, for example. So finally, that we want to be conscious always that measurement that is not done in an equitable and trauma-informed way can itself harm. So that's around the principle, the Indigenous principle that we've heard a lot about, which is nothing about us without us. So if you're interested in measurement, interested in measures and new ways to capture things, I know in my lab we've created measures for things like autonomy and respect and mistreatment. Other people may be interested in looking at models of care or organization of care. Please join us. You can go to the website and you'll see if you have your own measures, you have ideas about what these indicators should be. We want to hear about it. Thank you.